Good afternoon, everyone. I'm glad that you got the email and joined us for lab today.
Recording in
Like the
progress.
email said, today is obviously that dedicated study day for lecture, but we do have a scheduled lab today on the respiratory system, which is really, really important that it is in fact scheduled today because obviously on Thursday, you're going to have your exam. So I want you to get this extra dose, this secondary layer of the lab side of things to help you again, just to be thoroughly prepared. So just as a reminder, housekeeping wise, remember Thursday from 8 a.m. to 8 p.m. is your lecture exam. And then next week, and I know you guys won't forget this one, whoever would, next week is spring break. So a well-deserved break for all of you. Take a break from your studies. It really works out nicely that your exam is on Thursday, right before spring break. So you can kind of clean the slate and walk away and, not have to be thinking about, what should I be doing? There's really nothing you can be doing other than taking a mental health break and kind of recharging for that final push of the end of the semester. So I'm hopeful that that's what you're going to do with it. So today, like I said, we're going to do the respiratory system here. And then after spring break, that following Tuesday, which is St. Patrick's Day, March 17th, we'll do the digestive system. So the respiratory and digestive system are the two components of your third lab quiz, which will be the last Tuesday of March on your calendar. So talk a little bit about the lab quiz that you guys just took. You guys overall did a really nice job on that. Like I said in my email to you all, I don't typically share that up front because I don't want to, create apprehension or anxiety. But that was by far the toughest of the lab quizzes in Bio 211. And like I said, the reason for that is just the sheer volume of blood vessels to remember and absorb. But you guys did a really nice job with it overall, a really good job. So let me go ahead and start here with a
Recording
secondary
stopped.
housekeeping item that's really important. I want everyone to know what's going on and why, and that for the person that had an issue, just know that you've been heard and that an adjustment will occur. And guys, this is not intended to single anyone out because we're all different and we all learn differently. And again, that's the reason in lecture, I lecture, but in lab, I show videos and handouts and other things because again, we all learn differently. But I will share that someone voiced a concern about the way I'm handling lab this semester, and that quite frankly, that they felt that it was too short, that I was too brief over here in lab, and that getting you guys in and out of here was kind of doing them a disservice or not quite providing the length that they anticipated for lab. Okay, so I first of all, I want to explain to all of you why I do that and the two reasons why. Okay, and most importantly to that person that felt like maybe I was too brief over here. Okay, I just want to at least give you the rationale. It is not because I'm in a hurry or I'm trying to get done and be rid of you guys. Okay, the first of the two reasons is rather obvious, and that's that I have you guys also for lecture here, okay? Most of the time, as many of you know from Bio 210, you have different professors for lecture and lab. And so no one's quite sure when you're teaching one side of lecture or lab exactly what's being covered content-wise on the other side. Okay, and so therefore everybody just kind of opens up completely. But because I have you guys for lecture, I know that for the cardiovascular system, for example, I've lectured 3 lectures already, 3 complete, almost hour and 15 minutes on all the parts and on cardiovascular. And I've given it to you again and again and again and again. So by the time we get to lab, I just kind of condensed it because I know you've already heard it multiple times because I personally did it. I guarantee I know you know what you need to. Okay, so that's the first reason why I was able to move a little bit more rapidly through our lab than we otherwise would have. The second reason is, quite frankly, just because we're a remote lab. Okay, if we were live in the health sciences building, I would have you guys going into breakout sessions and working in groups, using plastic models to quiz each other on the various parts. And I would walk around and quiz and interact with you guys and help point out and answer any questions you have. All of those things are huge time fillers that we don't get to do here. And just like with the dissections, a dissection in a live lab can take 45 minutes to an hour. But if I show you, because we're not live, we're on a remote section, I show you the video, it may be done in 10 minutes, but that's because we don't have all the setup. We don't have all the instruction. We don't have all the cleanup, and it's cut and open and done for you. So I just wanted to emphasize, just so everyone's very clear, I am never trying to cut you guys short of your education. I was trying to not bore you guys to death by giving you the same content for the 4th and maybe 5th times. And then secondly, just the nature of going into a remote lab versus a live and what realistically we can do versus what we would do if we were in a live lab. So, all right. So that's the reason why the labs were brief, and I'll stand by that format because in years of doing this, I've never ever had anyone previously feel that way. But again, everyone's different, and that's okay. If you're the person that did, that's fine, not a problem. But just know that you've been heard. We're going to make some adjustments. I'm going to stretch out our labs a little bit to accommodate, but I'm also not going to stretch out immensely and make everyone sit here, because for those of you that are comfortable with the content because of hearing me give it to you in lab and lecture, at the end, I'm going to start staying on at the end, almost as if we were doing live breakout sessions if we were in a live lab. And I'll stay behind for anyone that wants to stay behind with me for any extra help. But that is going to be completely optional. So again, if you're one of the group that feel that you have it, you'll be free to go. If you feel like maybe you want a little more explanation and to more replicate a more interactive experience, if you have additional questions, then by all means you can hang out until you feel that you have enough, and then you can go. Okay, so that's one format that I can do to kind of stretch things a little bit without making everyone sit here, but providing extra layered learning for anyone that wants that. All right, so we'll talk about it again at the end. I'll let you know when it's time that you can go. All right, so that's just the only subtle change to what's going on and the why behind it. Okay, so let's go ahead. I sent you guys that handout on Sunday or Monday, maybe. I can't even remember which day, guys. It's been a chaotic start to the week. But I sent you a handout on the respiratory system. We'll be filling that out today in class. That's going to be a very, very valuable study guide for you. And I'll point out which things you really need to know to prepare for your next lab quiz. So let's start with the preview of lab quiz number 3. Okay, like I always do for you, I kind of show you and explain what it is you're going to need to expect on lab quiz 3. What's it going to look like? So lab quiz number 3, which again won't be until the last Tuesday of March, so you have a substantial amount of time until this happens. But there are 50 50 questions on that third lab quiz. All right. And the way it works out percentage-wise is 42% of lab quiz number 3, lab quiz 3, 42% of it is going to be on the respiratory system. Okay. 44% of those 50 questions are going to be on the digestive system, which we'll cover together on Tuesday after spring break. And then that leaves 3 little splinters, okay? And the first one we're going to cover, it's going to be included with respiratory today. There is 6% of lab quiz 3 will be on spirometry. And remember, we've already covered what a spirograph, a pulmonary function test is over in lecture, but we're going to cover it again here in lab. So 6% is on spirometry, and then 4% will be part of the digestive lab, and that's on enzymes. And then the last 4% is on scientific method. It's just 2 really easy questions related to research, to clinical research. I think that they just wanted to get you a little exposure to some basic things, and this is where they chose to include it in the quiz, okay? We'll include that as far as teaching goes with digestive, okay? So one more time, 50 questions, lab quiz 3, 42% respiratory system, 44% digestive system, 6% spirometry. We'll do both respiratory and spirometry today. 4% enzymes, that'll be coupled up with digestive system, and then 4% scientific method, research, that'll also be tied into the digestive system lab. Any questions about the quiz or the percentages, what I just covered with you? All right. Okay, so there's our preview of lab quiz number 3. And usually people do really well on lab quiz number 3. Okay, so if you didn't do as well as you had hoped you would on lab quiz 2, again, bear in mind, first and foremost, lab is only 25% of your grade. The vast majority of your 211 grade comes from lecture, and pretty much everyone is doing really well over there. Okay, so and then secondly, remember that was on paper the most difficult of the lab quizzes you're going to encounter in Bio 211 was that lab quiz 2. All right. So let's go ahead and let's start with, as I always do, with an overview of the parts of the respiratory system. I know we've covered this in lecture previously. It's a rather short video. It's only 7 minutes long, but it's a nice recap, and by design, with great intention, these videos are chosen and given to you to double up and complement what we've already learned over in lecture, so you're adequately prepared and thoroughly knowledgeable and understand the content for both the lecture exams as well as the lab quiz, okay? So this will be a little bit of recap. Hopefully it makes sense to you already. If so, you're on a great track toward Thursday's exam. If not, you probably need to roll up your sleeves. But here's the respiratory system overview video.
Take a look at parts of the respiratory tract. Now, we're going to follow the pathway of air from being inspired from the outer atmosphere all the way down into our lungs, and have a look at some of the major anatomical compartments or structures that air needs to move through, what we call the conducting pathways. First of all, when air is first inspired, it enters something called the nasal cavity. Now, once it enters the nasal cavity, it moves to the back of the throat, and that area we call the pharynx. And there's actually 3 parts to the pharynx. So I'm going to highlight this entire area here as the pharynx. Now, sometimes we can inspire air through the mouth. And so obviously that's going to go through the oral cavity. Now, with the pharynx, we've got the nasal portion, which we call the nasopharynx. We've got the oral portion, which we call the oropharynx. And we've got the next portion here called the larynx. And this part of the back of the throat, just where the larynx is called the laryngopharynx, which means that the next component is called the larynx. Now, what we've just highlighted here from the nasal cavity to the three aspects of the pharynx to the larynx is what we call the upper respiratory tract. Now, this is important clinically because you've heard of upper and lower respiratory tract infections. So obviously upper respiratory tract infections involve these anatomical components. So what do lower respiratory tract infections refer to? Well, we then go to the trachea. Air passes through the trachea and then the trachea splits. And this is known as a bifurcation. It bifurcates left and right. And once it bifurcates, it turns into the left and right main stem, like the stem of a tree, bronchi. So these are called bronchi. So I'm just going to label one, but we know we're referring to both, bronchi. Now, these bronchi will continue to branch, and they branch around about 23 different times. And what you'll find is that these various branchings result in, on the right-hand side, 3 lobes of the lungs: upper, middle, lower, or superior, middle, inferior. And on the left side, 2 lobes: upper, lower, superior, inferior. Now, the question probably is why 3 on this side and why 2 on this side? And it's because there's a little cut out of the lungs that you can see here. And this is called the cardiac notch because our heart sits a little bit to the left and we need to make room for the heart. So there's a little bit less lung on the left-hand side and therefore less room for lobes. And so there's only 2 lobes on that side. When we look at the bronchi, an important point is that the right stem bronchi, which you can see here, is wider and more vertical, which is important clinically because if some substance or object is inhaled, it's most likely to be found in the right stem bronchi. Now, after these bronchi, like I said, branch about 23 separate times, they go into smaller bronchioles, and then they start to turn into alveoli. And alveoli are the site of gas exchange. Now, trachea, bronchi, and the lungs, which include the alveoli, this is the lower respiratory tract. Again, very important clinically. Now let's have a look at, let's start back up here and work our way down and look at some important points. Firstly, in the nasal cavity, there are these various folds called turbinates. Now these turbinates are really important because they're lined by mucus and a lot of blood vessels. And what these turbinates do is when we inspire gas, when we inspire that air from the atmosphere, it spins the air around. The air goes in through these turbinates and it spins them, right? Now, what this does is it throws all the particulates that are in that gas. So it may be pathogens or pollutants or whatever it may be, and they stick to the mucus, which means we do not inspire any of these horrible things down into our lungs. The other thing is because there's a lot of mucus and blood vessels, it warms that air up and it humidifies that air, which is great because it makes gas exchange at the alveoli more beneficial. Next thing, we go back to the pharynx. Like I said, nasopharynx, oropharynx, and laryngopharynx, and then we move down to the larynx. Now, the larynx is our voice box. This is where we have our vocal cords. And you know where the larynx is because of the Adam's apple. Now, this is termed the laryngeal prominence, and it's simply cartilage. And both males and females have an Adam's apple. Important point. Now, you can also feel that there is underneath the laryngeal prominence, there is a soft portion here. And this portion is very important as an accessory airway if the airway is blocked superiorly. As we move down to the trachea, you can see there's a lot of cartilage lining the trachea, and this keeps it open. The term we use is patent. Think about sipping through a straw. If you would take a straw and put your finger on the end and suck on it, the straw collapses because there's a negative pressure. You take all the air out, so the pressure is negative inside that straw. Now, same thing would happen in the trachea because air moves in and out simply due to pressure changes. So we have cartilage lining the trachea to keep it strong and open. Now, as we move through from the trachea through to the bronchi, through to the smaller bronchioles, the amount of cartilage diminishes and the amount of muscle increases, which then means that as we move through these smaller airways, this is where muscle plays an important role, and they can open and close because that's what muscle does. It relaxes and constricts. And this is important clinically because asthma is a disease of the bronchioles, where the smooth muscle is, because it constricts. It's not a disease of the trachea or bronchi. Then as we begin to move down into our lungs and we have our alveoli, these are little air sacs. And the surface area of the alveoli is about that of a tennis court, which means there's a huge area for gas exchange to occur. And simply what happens is the inspired oxygen will jump into the bloodstream and the carbon dioxide in the bloodstream will jump out into the alveoli and move in the opposite direction, and we will expire. So these are the various parts of the respiratory system.
Neat. Okay. So, like I said, certainly I hope by this point that that was a little bit of a review for you, that those parts seem familiar to you, because again, your exam on Thursday is going to depend on it, and we've talked about it at length previously over in lecture. So I'm hoping that that's ringing familiar to you guys. Okay, I realize that presenter is obviously from Australia, and usually people kind of get a kick out of some of the terms and the pronunciations, especially with the trachea. Everyone usually gets kind of a kick out of the trachea instead. We certainly don't call it a trachea here in the United States, but in Australia, they speak differently than we do. Okay, so what we're going to do next in lab is we're going to work on that handout that I emailed to you. Okay, and like I said, that's going to be a really important study piece of material, a study guide, if you will, for Lab Quiz 3 related to the respiratory system, and that those 42% of the questions. Okay, so what I want you to do is get your study guide. If you remember in the email, I said have it with you in some format that you can make notes on it, because obviously we're going to label it. Okay, so that you can study from it and learn the parts that you need to be successful for the lab quiz. All right, so whether that's electronic or paper, that's up to you. Just be able to make notes on it. What I am going to do is I'm going to start here, and I'm going to tell you, because they are numbered, I'm going to tell you first which numbers. We're not going to label all of them. Okay, I don't want to overwhelm. We've talked about all of them in at length over in lecture. Okay, so I'm going to tell you which numbers. So just circle the numbers, or if you don't have it in front of you, write down the numbers. These are the ones that you're going to want to label, and then we'll come back and we're gonna have a breakout session. You guys are going to label, and then we're going to reconvene. And we're going to go through them, and I'm going to narrow more for you and tell you, we'll go through them and make sure you have everything labeled correct, so you're studying accurate information. So the numbers, let's start down that right-hand side with number 1, okay? And these are the ones I want you to label while we go into this next labeling breakout session. Number 1, number 2, number 3, number 4, number 5, number 7, number 15, number 16, and then if we move down into the bottom of the page, number 19, and then on the left-hand side of the page, all 3 of them, 21, 22, and 23. And then I'd like you guys to go ahead right now. And this is a great diagram that it found because it has all the critical components that we've talked about previously and we're talking about again today, except for one. I want you guys to draw, remember in lecture, I told you at the inferior end of the trachea, where it bifurcates and becomes the right and left primary bronchi or bronchus, is called the carina. Draw an arrow to that carina. And obviously, I've just given you that one. You'll need to label that, okay? Because that's one you're definitely going to need to know for the lab quiz. All right, so it is 2:46. We are going to take 20 minutes and do a breakout session where you guys will use whatever resource you want, whether it's your lab manual, if you want to use your phones to look things up, whatever it may be, go ahead and look things up and do your labeling of those numbers that I shared with you. And then we'll reconvene and we'll go through things together to make sure that you have them accurate, and I'll narrow your focus for the lab quiz. So it's 2:46. Let's just plan on meeting at, how about 5 minutes after 3 o'clock? 3:05, we'll reconvene. All right, do your labeling and we'll see you at 3:05. Okay, guys. Welcome back. Hopefully you got some of them at least done. Um, Hopefully many of them. And again, hopefully some of these were rather easy for you at this stage. At least they should be, if you're adequately prepared for Thursday. So let's go ahead and just move right down in number order, and we'll go through and we'll do the labeling. And again, these should be fairly repetitive. Number one is that, and that one's a little bit odd in that it just looks weird the way it's sitting there, but that is the epiglottis. Okay, that's the epiglottis. That's that flap of skin, remember, elastic cartilage that flaps and directs food down the esophagus and air down the trachea. Okay, so one is the epiglottis. Number two is the larynx. Okay, two is your larynx. And remember, it's within your larynx where our voice box, our vocal cords are held, both true and false vocal cords. And we'll see those in the slides coming up. Number three is just cartilage, but specifically it's called the cricoid cartilage, CRICOID, CRICOID, cricoid cartilage. And again, that is our Adam's apple, okay? And again, just an extension off of the larynx. Number four, then, I hope everyone got that one off the top without needing help. That's the trachea, or if you're Australian, is your trachea. Either way, it is your trachea. And remember, we've talked about that C-shaped cartilage lining, right? That makes up the trachea, that keeps it open and patent. That's really important. Okay, down to number five. In this case, number five, what it's looking for is the specific lobe of the lungs, okay? So for the lab quiz, you're gonna wanna know both of the lobes of the left lung and all three of the lobes of the right lung. Number five is that superior left lobe, okay? And you can see the dashed lines indicating where the lobes change names. So five is the superior left lobe. Then we'll go down to number seven. Remember, we skipped six. We'll go to number seven. And in this case, that's the primary bronchi. It's the left primary bronchi. And again, just as a reminder, guys, we did have it, and this happens all the time, okay? So this is not, meant as negative, but just a teachable moment. So hopefully you can learn from it if it happened to you. But we did have a good number of students that forgot about kind of the golden rule of labeling when it comes to anatomy and physiology. Remember, it's always the patient's left and right, not what you're seeing on the paper. Okay, so number five is the superior left lobe, even though it's your right, it's the patient's left. Okay, and number seven is the left primary bronchi. Okay, in the cardiovascular one, several people got things twisted around and were labeling left and right wrong because they were going by what they saw, not the patients. So just try to really watch yourself and be conscious of that on quizzes moving forward, so you don't lose, easy points. All right, we will skip down then to number 15, and then that's going to be that second lobe of the left lung, and in this case, it's the inferior left lobe. So 5 was the superior left lobe, 15 is the inferior left lobe. Okay, and remember, there's only 2 lobes of the left lung because of the heart occupying some of the space. So the left lung is smaller in size, hence only 2 lobes versus the right lung. Number 16, underneath that, just that thin little muscle is our diaphragm muscle. And that diaphragm muscle that we talked about in lecture that when it contracts, it moves downward, expanding the size of the thoracic cavity. That's our diaphragm muscle, is number 16. Moving underneath, number 19, that's the cardiac notch. Okay, and we talked about it. That's that kind of cutaway, if you will, cut out area because of the position of the heart. Okay, and again, the reason the left lung is smaller than the right. Okay, so then coming down the left side of the page, depending where you drew it, this is where I have my arrow to the carina. And remember, the carina is that termination of the trachea where it splits, where it bifurcates into a right and left primary bronchi. Okay, but make sure you have an arrow going there. That's the only one that wasn't included as far as an arrow of something you really need to know for the lab quiz. Know that carina. All right, and then the next three, 21, 22, and 23 are all just talking about the lobes of the right lung, patient's right. So 21 then, of course, is the superior right lobe. 22 is the right middle lobe. And 23 is the inferior right lobe. Superior and inferior on the left, superior, middle, and inferior on the right. And don't forget about that cardiac notch. Okay, so like I said, there are other arrows there, but we've talked about and you've learned about all of those things before, as far as the other extended branches of the bronchial tree, for example, and then 12, 13, and 14 all have to do with the pleural serous membrane, that visceral and parietal layer, with 13 being the pleural fluid in between. So those are things, again, that you have learned and you know, but I didn't highlight them, and you don't need to label them because I don't want to take away from or have you spend a lot of time focusing on what isn't going to necessarily be on the lab quiz. Okay? Any questions about any of those on the diagram that we just labeled that you absolutely are going to want to know for the lab quiz?
I have a question. That's right. For the quiz on when you have the inferior lobe, and if it points to that and we put inferior lobe, do we need to just put inferior lobe, or you want us to put inferior lobe of left lung?
You can just put inferior lobe. You don't have to put left or right.
Okay.
If you want to, that's fine, but you don't have to. Okay.
Okay.
That's a great question, though. No, I don't need you to be that specific, but thanks for asking that one.
Okay. Thank you.
And I wanted to ask for superior, if we wrote left upper lobe, would that still be okay, or it has to be superior?
That would be fine. If you use upper, lower, and middle, because those are technically correct also, that would be fine. Correct. No, thank you. Thank you for bringing that up also.
Doc, on number 1, can you spell the epicardia for me?
Epiglottis?
Yes.
Absolutely. Epi, E-P-I, and then the glottis portion of the word is G-L-O, and then 2 T's, T-T-I-S. Epiglottis, G-L-O-T-T-I-S.
Thank you, Doc.
You're welcome. Anyone else with any questions about the study guide that you just completed? Okay, so that study guide, for those of you that had me for Bio 210, you know this with confidence. Whenever I give you a study guide and the things that we fill in, are absolutely things that you're going to need to know for the lab quiz, okay? So use this, know this for lab quiz number 3 for the respiratory side, okay? Handy dandy study guide to not only show you what you need, but to really narrow your focus beyond those ones that we didn't label. All right, so let's look at, and speaking of things you need to know for the lab quiz, let's go ahead and look at the PowerPoint, the presentation, quiz 3 presentation content. Okay, and as you know by this point, what are on my slides you're going to see again. So they're really, really important for you to know and to study these slides. Okay, so let's go ahead. There aren't that many slides because we just went over on the handout quite a few different parts, right? So there aren't that many slides. There's only 8 of them, I believe. But we'll go over these slides and I'll focus you in on what you need to know from this presentation. All right, so the first thing that you are going to want to know about, let's see, is this upper respiratory tract, okay? And again, we've talked about this at length over in lecture, okay? So this should be already known to you, okay? But just know the main parts. Now, I want to emphasize, you do not need to know all of these things on this slide, okay? You need to know the main parts that we've talked about over and over again, okay? The nares are your nostrils, right? The nasal cavity, the oral cavity, these are things that we've talked about time and again already, right? Within the nasal cavity, remember, we have the ridges that are formed. We have 3 different passageways that air that's inspired through the nares can make its way back to the pharynx that we'll talk about in a minute here. But these 3 different passageways are formed by what are called conchae, okay? And there are 3 of them: a superior conchae at the top, a middle conchae here in the middle, and then a inferior conchae at the bottom, okay? And these are just ridges, physical ridges that create the 3 corresponding nasal meatuses. The meatuses, like we talked about in lecture, these are the passageways that the inspired air makes its way from the nares through the nasal cavity, ultimately arriving back in the pharynx, okay? So these passageways, again, are called meatuses, and they're labeled the exact same as the conchae that form them. Superior at the top, middle in the middle, and inferior at the bottom, okay? So the conchae are the ridges, superior, middle, inferior, and then the meatuses are the channels, the passageways, the tubes that air can move from the nares, our nostrils, back to the pharynx, okay? Know the conchae and the meatuses. All right, then we get back to the pharynx, which we've talked about quite a bit already, but I'll recap it because that's what this is all about. Okay, and remember, the pharynx is just that tube of muscular tissue at the posterior of the nasal and oral cavity that then is going to descend into the throat. Okay, and it's just a passageway for food, air, and beverages that we've ingested to make their way toward either the stomach or the lungs. Okay, and again, as a recap and a reminder, the pharynx is broken into 3 different subsections based on where it is anatomically. At the very top, the most superior portion of the pharynx is the nasopharynx, okay? And that is right behind the nasal cavity. If we continue downward inferiorly, we have the oropharynx, which is the next segment of the pharynx, and it's right behind the oral cavity or our mouth. And then if we continue inferiorly, the last section of the pharynx is called the laryngopharynx, and that's where the pharynx terminates or ends and becomes the larynx and the esophagus. Okay? So nasopharynx behind the nasal cavity, oropharynx behind the oral cavity, and laryngopharynx where the larynx meets the pharynx. The larynx and pharynx meet each other as well as the esophagus. Okay? All right, so just know those three main subcomponents, know the pharynx and the three subdivisions of that pharynx. All right, then we talked about the epiglottis, and you've labeled that already, so you know you need to know the epiglottis. And again, that is that flap of elastic cartilage that is like a traffic director. If it's food or beverage that we've taken in, the epiglottis will seal off the larynx and direct food and beverages down the esophagus toward the stomach. And if it's air that we've ingested from either the nasal cavity or the oral cavity, this epiglottis flap of cartilage will seal off the esophagus and direct air down the larynx, eventually then into the trachea, and eventually to the bronchial tree and lungs. Okay? So an important flap of cartilage is the epiglottis. Okay, and then of course we have the larynx that we talked about underneath it, the larynx with the vocal folds, which are our vocal cords, okay? And we'll talk about those with the trachea in a minute on coming slides, okay? So from this slide, again, you don't need to memorize all of it, like the tonsils, for example. You don't need to know those for this, the uvula. We didn't talk about that, okay? But know the oral cavity, the nasal cavity, the nares, the conchae and the meatuses that we've talked about several times now. And then the pharynx with the three subdivisions thereof, naso, oro, and laryngo. And then the epiglottis, which is that flap of cartilage that separates things out from going down the esophagus or into the larynx. Okay? That's what you need to know from this one related to the upper respiratory tract. All right, so that's by far the most complicated or involved slide for you guys, okay? And like I said, most of those things we've already talked about over in lecture at length. All right, so now some specifics, additional specific slides, and I think there's only 6 of them, okay? But you're gonna need to know them for the respiratory portion of Lab Quiz 3. The first one is the trachea itself, back to Bio 210 and tissue types. Remember, pseudostratified columnar epithelial tissue, okay, that had cilia attached to it. The cilia, these hair-like fibers that work like sweeping mechanisms, almost like little brooms that keep things moving, right? Our trachea consists of, certainly it has those C-shaped cartilage rings that we've talked about time and again that are important for you to know. But the actual tissue type between the cartilage rings of the trachea is pseudostratified columnar. Remember that one, know that one for the lab quiz. All right, then continuing down into that larynx, again, if we have a cutaway version here of it, okay, and we talked about in lecture about the 2 different vocal cords, right? We have our false vocal cords or vocal folds, either name is acceptable, at the top, and then right underneath them are our true vocal cords or vocal folds. Again, either name is accurate underneath. Know which one is which. The false vocal cords are at the top. They're more superior. The ones that are inferior within that larynx are our true vocal cords. Okay? So know those, the vocal cords. That's why it's highlighted here for you to know that, okay? Moving on. Same image, this time looking at the thyroid cartilage itself. So the thyroid gland within the larynx is protected by cartilage that goes around the outside around the outside of the larynx to protect that thyroid gland, and that is called thyroid cartilage. It's a cutaway here because that's what we're looking at from an illustration standpoint, but in actuality, it would cover, you know, right over the whole thing, right? It wraps all the way around it. Okay, but this is cartilage that is called the thyroid cartilage because, again, we remember from endocrinology that the thyroid gland, that hormone producing gland, is in our throat, right? Well, it's very specifically in our larynx, and it's protected by a band of thyroid cartilage, which consists of hyaline cartilage type. Okay, so the name of the cartilage band that wraps around the thyroid gland as part of the larynx is called the thyroid cartilage, but it's made up of hyaline cartilage tissue type. And if you remember, elastic tissue is the most bendable, like our upper ear, like our outer ear, and we just talked about that epiglottis. And then the second most bendable type of cartilage is hyaline cartilage. The comparison that I always use when I teach cartilage types is that's the septum in our nose that divides our right and left nostrils, is that hyaline cartilage. That's what the thyroid cartilage band consists of. So know these two things. All right. Continuing, couple more slides. We talked over in lecture about that hyoid bone that, as we can see, it's a C-shaped, very fragile, thin bone that physically anchors the larynx to the structures in our throat, okay? And you can see that in this illustration, right? It's actually attached to the larynx and helps to hold that larynx in place, okay? So know the hyoid bone. Back to Bio 210 for the next two, okay? Back to bones and that dreaded bones quiz that everybody loved back in Bio 210, okay? Remember, we have the roof of our mouth. We have the hard palate, which is made of bone at the front of the roof of our mouth on the maxilla bone. And then we have the soft palate made of tissue in the posterior aspect of the roof of our mouth, okay? Separates the nasal passage above it and the oral passage below it. The two bones that make up the hard palate or the roof of our mouth in layman's terms are the maxilla, which is this entire front portion shaded in purple here, and then the palatine bone, which is this little off green color back behind it. And then, of course, if we continued further in, we would have the soft palate. Okay, so know the two bones of the hard palate, the maxilla and then the palatine bone. Now, as you can see, you could call the maxilla this portion. Also, it is appropriate to call it the palatine process. So if you want to call this portion of the hard palate the palatine process and this one the palatine bone, that's fine too. Maxilla or palatine process, two names equally correct. All right, the last one related to respiratory, and then we're going to get into spirometry. Okay, and this is, of course, a histology slide, a microscopic image of lung tissue. Okay, this is an image of lung tissue, and these are the simple squamous epithelial cells that make up our alveoli. Okay, again, this is a cutaway, thin slice like you'd see on a microscope. Okay, but when you see this image on the lab quiz, be able, and it says, name the organ that this tissue comes from. Recognize this as lung tissue. Okay? That's what you need to know, is just that it's lung tissue. Okay. Any question about those slides that we just went over related to the 42% of the quiz that are the respiratory questions? Okay. So between those slides and everything that I just showed you and the study guide that we filled out together, those are the 42% of lab quiz number 3 that are respiratory system questions. All right. So you now have in your possession all of those. All right. So now remember I said the second layer, very much related obviously to the respiratory system, is spirometry. And that was going to be 6% of lab quiz number 3. So we'll go ahead now and change gears. Again, this will be a refresh because we've already talked about this in lecture, but we're going to talk briefly about spirometry again, which is a good dust off before the exam on Thursday, as well as prep for the lab quiz later on in the month. So, all right. So I have an AI generated 4-minute video on spirometry because, again, I lectured to you about it, but sometimes seeing it in video form also helps to make sense of it, or better make sense of it, connecting the dots for you. Short video, very short video, and then we'll go over some slides that you'll really need to focus on for the lab quiz related to spirometry.
Spirometry is a common test for lung function. It is used to diagnose asthma, COPD, pulmonary fibrosis, and other lung diseases. It can also be a helpful tool to monitor disease progression and evaluate effectiveness of a treatment plan. A tube-like device called a spirometer is used to capture and record air volumes and breathing speed. A spirometry test typically reports 4 respiratory volumes: tidal volume, TV, the amount of air inhaled or exhaled during normal, quiet breathing without effort; inspiratory reserve volume, IRV, the amount of air that can be inhaled with maximum effort after a quiet inhalation; expiratory reserve volume, ERV, the amount of air that can be exhaled with maximum effort after a quiet exhalation; residual volume, RV, the amount of air remaining in the lungs after a maximum exhalation. These volumes are used to calculate other parameters called respiratory capacities. Inspiratory capacity, IC, the maximum amount of air that can be inhaled after a quiet exhalation; functional residual capacity, FRC, the amount of air remaining in the lungs after a quiet exhalation; total lung capacity, TLC, and vital capacity, VC, the amount of air that can be exhaled with maximum effort after a maximum inhalation. This is basically the volume of the deepest breath the lungs can possibly handle, and is an important indicator of pulmonary function, as well as strength of respiratory muscles. Vital capacity can be measured as slow vital capacity during slow, relaxed breathing, or as forced vital capacity, FVC, when the patient is asked to breathe out as hard and fast as possible. While there is little or no difference between these two values in healthy individuals, people with difficulty exhaling usually show significantly lower FVC. Another important parameter obtained during forced spirometry is the forced expiratory volume, FEV1, the amount of air that is exhaled during the first second of forceful exhalation after a full inhalation. FEV1 is used to calculate the percentage of air that is expelled during the first second. This FEV1 over FVC ratio inversely reflects the resistance to expiratory airflow. In healthy people, it is around 70 to 85%. A smaller number means increased lung resistance. Spirometry is useful in differentiating between restrictive and obstructive pulmonary diseases. Restrictive lung diseases can be inspiratory or expiratory. Inspiratory restrictive are conditions in which lung compliance is reduced, limiting lung expansion when inhaling. This can happen either because the lungs become stiff as a result of scarring or fibrosis within lung tissues, or the respiratory muscles are too weak to inflate the lungs. Expiratory restrictive is when exhalation volume is limited due to weakness of accessory muscles involved in deep exhalation. Restrictive lung diseases are associated with decreased lung volumes, or total lung capacity, TLC. Obstructive lung diseases, such as asthma or COPD, on the other hand, show a normal or somewhat increased total lung capacity, TLC. This is because the obstruction increases lung resistance, making breathing out harder and slower, and this results in increased residual lung volume. Vital capacity remains normal during quiet breathing, but when breathing rapidly, a higher pressure is required to overcome the increased resistance, and forced vital capacity is reduced. A more reliable indicator of obstructive lung disease, however, is the lower percentage of air that is exhaled during the first second of forceful exhalation.
Okay, so as I promised, a short but sweet video. Again, everyone learns differently. So I love to, and very much by design, include videos here, even though they're things that we've talked about previously. It is good to see them and hear them a second time to help you guys to be successful, which is my ultimate goal of teaching this class. Okay, I want you guys to do well in this course. Okay, so it may seem repetitive, it may seem redundant at times, but it benefits the masses. So we do it. All right, so only 2 quiz related questions, slides in the presentation related to the spirometry portion of lab quiz number 3. Remember, it was only 6% of the quiz. The first one is going to be a really, really easy one that I don't think in 5 years of teaching now this course, I don't think I've ever had anyone get this one wrong. Okay, this is the old-fashioned spirometer test. Okay, remember I told you in lecture that it has a tube that the patient blows in, and then it was a manual gauge that the respiratory therapist would record different readings at to create a spirometry report. Nowadays, of course, it's much more, it's computerized. These old handheld devices are largely outdated. You'll still see them from time to time, maybe in a primary care office or something like that. But for the most part, everything is electronic and computerized nowadays. But for you guys, for Bio 211 at MTC, when you see this image, recognize what this test is and what it does. It is a spirometer, and it's used to measure respiratory function, like we've heard and talked about several times at this juncture. All right, the next one. This image looks exactly like the image in your lecture slides, okay? And we went through all of these, so I'm not going to do that again now. However, if anyone wants to stay after in the optional part of today's lab and have me go over these again, I will. But a quick recap. So for those of you that are comfortable with the content, you could be on your way. We have the tidal volume, okay? Remember, as the graph goes up, this is the printout of a spirometry test, okay? As the line goes up, that's inspiration or inhalation. And as it goes down, that's expiration or exhalation of air. Okay, this up and down pattern right here between these dashed lines is called tidal volume. That is your resting breathing capacities when you're just sitting like we are now at rest. Okay, for the lab quiz, no tidal volume. Okay, know what tidal volume is. Be able to recognize it on this chart and know what it is, that it's your breathing rates during rest. Okay, and then we have the maximum you can inspire, you can breathe in during a pulmonary function test is the inspiratory reserve volume. And then the maximum you can exhale during a pulmonary function or spirometry test is the expiratory reserve volume. And remember, with the lungs and the pulmonary system, our lungs never totally deflate. So that amount of air that's left in our lungs after a maximal effort exhalation, we've blown out as much air as we can. That amount of gas that stays in our lungs to keep our lungs inflated is called the residual volume. Okay, those are the big players right there. Okay, again, for the lecture exam, other things are highlighted, but for the lab exam, no tidal volume. Okay, those are the only two slides that I have related to spirometry, which is only 6% of lab quiz 3. So that in total, between everything that I've provided you today, is 48% of lab quiz 3. After spring break, which is next week, we'll go ahead and come back and we'll do the digestive system along with enzymes and those couple of research related questions that'll give you the rest of the content you need for lab quiz number 3. Okay, so are there any questions on spirometry? Okay, all right, so at this point, this is where I will say, lab, for anyone that wants to leave, if you're comfortable with the content that I taught you today about the respiratory system and spirometry, you can leave now, okay? If anyone has any additional questions or wants me to go over something in more depth, and this is again to expand the teaching learning experience to kind of closely replicate more what we could do in a live lab group work type session, I will stay behind until the last person leaves. Okay, so you are free to go if you'd like. That's it for content today. Okay, if you want to stay, and if you don't, if no one wants to stay, that's fine too. Okay, that's fine. If everyone has it, great. I just want to be absolutely sure that I'm meeting everyone's expectations of what you want out of this lab. Okay? All right, so for those of you that are leaving, hey, have an excellent and safe spring break. And good luck on the exam on Thursday. Don't forget your exam for lecture. Do well on that first, then have a tremendous spring break, everyone.
Thank you, Doc.
Thank you.
You're welcome, guys.
Dr. Fine.
Yes.
Yeah, can you go back over? I got the tidal volume and what the tidal volume is. Can you go back over the inspiratory volume and the expiratory volume? What it means?
Yes. Okay, so during a pulmonary function test, the patient would be sitting, resting before the test starts, and we would acquire this data, the inspirations and expirations. Then the pulmonary therapist would say, I'm going to want you to exhale with all the force you can for as long as you can. Okay. And that's what we're seeing here. This graphic is as that patient, to inhale with as much force as you can for as long as you can. And that's what we're seeing here on this tracing is that maximum inspiration, okay? And so what we're seeing here is this inspiratory reserve volume is the amount of air that this individual patient's lungs can pull into them beyond what they inspire during rest. So that's the inspiratory reserve volume. It could just as easily say inspiratory extra capacity. It's how much extra space is in there that if you had to, could you inhale? That's what inspiratory reserve volume is measuring. Then in that same test, the pulmonary therapist would tell that patient now to suddenly exhale with as much force and for as long as they possibly can. And then that's what we're seeing right here as this graph moves down. So the expiratory reserve volume is exactly that. It's the opposite of the inspiratory. How much air can the patient push out of their lungs beyond that they do during rest with force? So that's the expiratory reserve or expiratory extra capacity of their lungs. Does that make sense?
Oh, yes, yes. Thank you so much.
You're very welcome. You're very welcome. And of course, if we add, from these four, the residual, the expiratory, the tidal, and the inspiratory, we could add them together, much like we could with figuring out cardiac output in the cardiac world to come up with these other numbers that are just of interest, okay? I mean, total lung capacity is everything. Vital capacity is as much as you can possibly pull in and out. Inspiratory is maximum inspiration, including rest, much less the reserve. And then expiratory is how much could we push out plus what is the reserve. So again, just different formulas that if you were in the respiratory field would be important to determining disease.
Okay, so the residual volume is the air left in the lungs. Am I correct? The amount of
That's
air
right.
left in the lungs?
Exactly. It's the air that never leaves the lungs to keep them inflated.
Okay, thank you so much.
You're very welcome.
All right, have a good day.
You too. And have a great spring break.
Thank you.
And anyone else with anything, or are we?
I have a question. So basically, we just need to review all these for the test, and then we're good. We don't have to submit our, any questions or anything. Just review this.
Right. Just like for the first two labs. Yep. You're gonna study my slides and you're gonna study the content that I told you you needed. In this case, it would be the slides related to the respiratory system, the two slides related to spirometry, and then the study guide that we created together. And those are the content that you need to study for lab quiz number 3. And of course, we'll add to that with the digestive system the week after spring break.
Okay, thank you.
You're welcome. All right, guys. If everyone else is comfortable, then I will go ahead and close our meeting. But I think that this is going to work out well. Hanging out longer. Again, if we were in a live lab, we could hang out and have extra questions technically after the lab content sharing portion ended. So this will allow us to do this through the remainder of the course in lab, but I make it optional because again, if you know the content and you're comfortable with it, then that's fine. Okay. So guys, have a tremendous spring break. Good luck on the exam on Thursday for lecture. Finish strong and then take a well-deserved.
Sir, I do have one question actually. Like related to the exam on the Thursday, I'm not doing well, like physically. I do have a flu. I want to do my best on the test, but I'm not able to study for this time. So I just want like your advice, like how can I do better? Like just studying those underlying materials, like will be like okay for me to study for this test?
Yes, absolutely. That is exactly right. Yes, first of all, I'm very sorry to hear that you're not feeling well, and I hope you feel better soon. Hopefully, that's still 48 hours away, so maybe with a little luck, you'll be back on your feet by then. But I understand what you're saying related to studying and how that can impact your ability. Yes, concentrate as always on my presentations and on that underlying content. And again, remember, we've even went over what those matching questions are. If you prepare from those, you are going to be in excellent shape for the exam.
Okay, thank you so much, sir. Thank you.
You're very welcome. Okay, everyone. For those of you left, if there are no additional questions, have an excellent spring break. Good luck on the exam, and we'll see you after spring break.